No matter what your age or situation, you've probably experienced some level of stress in your life. Your body may be put under physical stress if you develop a personal injury or illness. Likewise, you may encounter psychological stress when the situations you face seem difficult or unmanageable. The death of a loved one, a financial crisis, or a fast approaching deadline. These are all examples of situations and events that can cause us to experience psychological stress. Often referred to as the fight or flight reaction, stress is your body's normal reaction to a perceived threat. Whether that threat is a hungry bear at your heels or an angry boss on the phone, your body prompts the release of hormones, the most abundant being adrenaline and cortisol. Adrenaline increases your heart rate, elevates your blood pressure, and boosts energy supplies. Cortisol, the primary stress hormone, increases sugars in your bloodstream, enhances the brain's use of these sugars, and makes tissue-repairing substances more available. Cortisol also alters immune system responses and suppresses the digestive and reproductive systems. The problem is that if stress responses are prolonged, the overexposure to cortisol and other stress hormones can disrupt your body's normal functions, increasing your risk of things like obesity, insomnia, digestive problems, heart disease, depression, memory impairment, and musculoskeletal disorders. Other stress-related health problems include allergies, asthma, and migraine headaches. Immune systems are more vulnerable during times of stress as well, opening the door to colds and other illnesses. In fact, medical research estimates as much as 90% of illness and disease is stress-related. Excessive stress in your life also interferes with your relationships at home, on the job, and in other social circles. It can drain your energy and cause you to become more irritable, depressed, and even more prone to accidents or substance abuse.
What I see the most in my practice is people that can have elevated blood pressure, they can have headaches, fatigue, they're not sleeping well, they're overall not feeling well, they're having increased difficulty concentrating and focusing, accomplishing the tasks that they used to be able to accomplish in a briefer time period. They're just not as functional.
The good news is that stress can be managed. The first step is to identify the things that cause stress in your life. Some of the challenges we face in life are essential to keeping us motivated and fostering personal growth. However, stress enters the picture when you feel like the resources you possess are not equal to the challenges you face. When that happens, there are two ways of managing your stress. One way to reduce stress is to learn to take control of stress-inducing circumstances. Here are some suggestions. Prioritize. Rank duties and chores in order of importance and consider dropping any unnecessary items. Be realistic. Try to set realistic expectations and deadlines at home and on the job. Get organized. Consider using a daily planner or address book. Avoid interruptions. For especially important or difficult projects, reserve an interruption-free block of time behind closed doors. Choose your battles wisely. Don't rush into an argument every time someone disagrees with you. Keep cool and save your energy for more productive outlets. Set limits. When necessary, learn to say no in a friendly but firm manner. Avoid stressors. If traffic jams cause stress, consider taking another less stressful route home, even if it takes a bit longer. Be decisive. Indecision can cause stress, so give yourself a reasonable time to weigh your options and then take action. And finally, avoid dangerous situations at work or at home. Don't compromise your safety just to get the job done. While taking control of stress-inducing circumstances is a positive first step, there will always be situations in life that we simply cannot control. That's why it's essential to learn how to take care of yourself physically and emotionally when you face events that are out of your control. Here are some tips. First off, assess your attitude toward life in general. Are you thinking positive, or are your thoughts dominated by negativity? You may need to make an effort to replace negative thoughts with positive ones. You may also need to take a break and have some fun. If that fun can involve physical activity, there are additional benefits. Study after study has proven that regular physical activity for at least 20 minutes per day, several times a week, lowers your risk of many diseases and contributes to a general feeling of well-being. Exercising with a friend or coworker will enhance your experience and help you remain consistent. Good nutrition is key to managing stress as well. Times of stress often make fatty, sweet, and salty foods more appealing. Resist the urge to garbage up and eat foods that improve your health and well-being instead. The food pyramid is a good guide. Along with healthy diet and exercise, it's important to have the support of friends and family. Many stressful situations can seem less stressful after a good talk with a caring and trusted companion. Social interaction that takes your mind off of your stress will do a world of good as well. Last but not least, try using one or more proven relaxation techniques. And while a few minutes of deep breathing or relaxing to music may relieve most of your tension, a mini retreat may occasionally be in order as well. In today's world, stress is nearly unavoidable. However, learning to deal with stress as it occurs will help you avoid many of its negative complications. If you continue to have difficulty managing your stress, you may want to consider talking with a professional social worker, counselor, or healthcare provider. Whatever you choose, remember that stress does not have to control you. You can manage it and enjoy a more relaxed and productive life.